Cameras in?
Yes, sir.
Okay, good. All right. Good afternoon, and thank you for taking time from your busy schedule to cover this event for Northeast Florida law enforcement. Today I have the pleasure representing the Florida Department of Law Enforcement in the North Florida HIDTA Intensity Drug Trafficking Area, HIDTA. With me today, of course, is Sheriff John Rutherford, Ed Williams, the HIDTA Director for North Florida, and Assistant Chief Pat Ivey. Today, the North Florida HIDTA is a federally funded program comprising of city, county, state, and federal law enforcement, working in a partnership to attack the drug problem in North Florida via disrupting local illegal drug markets in a 10-county area. The HIDTA program spans 10 counties: Alachua, Baker, Clay, Columbia, Duval, Flagler, Marion, Nassau, Putnam, and St. John's. Two identical press conferences like this one is being held in Alachua and Flagler County as we speak to talk about the successes of this operation. The annual HIDTA drug threat assessment identified a rise in the diversion of pharmaceutical drugs escalated to the region's #1 drug threat. In conjunction with the threat assessment, the Florida Medical Examiners Commission drug report of 2009 and the interim report of 2010 showed an increase in deaths due to an overuse of prescription pills. And of course, there's a chart there that reflects that critical trend. The HIDTA Executive Board implemented Operation Growing Pains to help combat the increase in pharmaceutical drug abuse. The operation commenced on September 1st, 2010, and culminated on December 15th, 2010. 6 HIDTA task forces focused all of its efforts on the diversion of pharmaceutical drugs. The results of this operation are captured on this chart right here. This is the overall. We have 16,978 pills seized. These are the top 3 drugs seized. The street value of those drugs, $152,823, and 135 arrests. At this point in time, I'd like to turn the forum over to Sheriff John Rutherford to explain his successes and the leadership that he has provided attacking this problem.
Thank you, Dominic. By far, more people die from overdoses from prescription drugs and medication than by cocaine or heroin or a combination of illegal drugs. This is becoming an epidemic where the user's age is becoming younger and younger. Even teenagers we're beginning to see. The availability of these prescription drugs, obtaining medication from parents and grandparents, and the reselling of these drugs makes their availability very similar to that of marijuana at the street level. You've heard about the 3 pill mills that we've closed in recent months, and what you may not realize is some of the customers of those places don't stop trying to secure the pills because they make their very livelihood reselling those prescriptions on the street. It's also important to mention that not all customers of these clinics have illegal intent any more than all pain clinic operators are operating illegally. But the criminal buyer and distributor, for them, the market is very, very profitable. And they will travel great distances to keep their supply coming in. Perhaps as alarming to us in law enforcement as the problem itself is also the number of deaths that result from people overdosing on prescription medication, either obtained under false pretenses or for purposes for which it was not prescribed. And the real killer here, particularly statewide, is the benzodiazepines, commonly known as Xanax and Valium. And you couple those with a beer or a glass of wine, and depending on the individual's medical condition or tolerance of the user, you could have a very lethal cocktail. And prescribed medication, I will tell you, prescribed medication should only be taken under the supervision of a doctor. These prescription drugs need to be kept in secure locations at home, and the prescription holder should also hold him or herself accountable for the way that they're stored and maintained at their home. And if you look at the board, these are the deaths that we've had, and again, these are the benzodiazepines, Xanax and Valium, and you can see combined on the statewide level, they are the highest killer here. Operation Growing Pains is the overarching operation. Within that, that, the Jacksonville Sheriff's Office was actually conducting two related operations. One was Dun and Over, as we reported before, the pill mill out on Dunn Avenue, and then No Pain, No Gain, which was actually two locations that we closed. One of them was the Duval Wellness Center, and the other was the First Coast Pain and Urgent Care Clinic. Both of those were closed, and you can see, to show you a comparison, for this operation, the entire HIDTA pulled in 4.3 plus million, and JSO was responsible for 4.2 million of that 4.3. So we've been very active in going after these pill mills, mainly because when you look at these death boards, it's really incredible the way these numbers are climbing. And you know, again, when you mix these with alcohol, it becomes a cocktail that a lot of these casual users just don't realize, I don't believe, just how lethal that can be. And so, you know, we here at the Sheriff's Office first started working these pill mills back in 2007. Some of you may remember Medication Station when we closed the pill mill out on Lem Turner Road. This is quickly becoming a major problem, or not quickly becoming, it is a major problem in Northeast Florida. And we're addressing it both at the JSO level and, of course, at the HIDTA level on a regional basis also. And so I appreciate the support of FDLE and our HIDTA partners. Also, the DEA, SAC, Cam Strom over at the DEA is a great partner in this initiative, as well as Tony Charbat over at the FBI, who's working with us on these cases as well. With that, I will throw it open for questions.
So it sounds like we've often heard in the past about crack and heroin as being major drug epidemics. Are prescription pills now the new epidemic when it comes to drugs on the street?
Exactly. They have now been, those drugs have now been eclipsed by prescription medications.
Is it such a problem because they're so easy to get?
Yeah, I think that's a great point. They are easy to get because they're out there in the public legally. And, you know, a lot of people, they just put them in their medicine cabinet or, you know, the cabinet in the kitchen and don't think any more about it. And they have oxycodone and they have Xanax and they have, you know, and they just store these things unsecured. And if they have young children, teenagers, as I mentioned earlier, we're starting to see a lot of teenagers getting involved in this. That's where they get it from.
What are the
Yes,
ages?
Yeah, go ahead.
What are the ages? And you're saying teenagers. About how young and how old is the?
Well, I mean, it runs the gamut. You know, a lot of them 15, 16, 17 years old. Yes, ma'am.
Obviously, as you pointed out, a tremendous chunk, 4.2 out of 4.3 million, came from Duval and Clay counties. To you, does that represent the amount of manpower that put into it, the amount of supply that's in our area, or is it some combination of both?
Well, it's a little bit of both. We obviously put, because we are in one of the largest areas in Northeast Florida, obviously, but we also have a very large landmass. And we've been operating tactically against these pill mills for some time, as I said, going back to 2007. So we have some great expertise. Pat Ivey and his folks do a fantastic job in actually going in and tactically going after these pill mills. I tell you, the problem is, though, it's a very tough investigative process. And what we're looking for out of the legislature is to also find ways that we can administratively go after these pill mills and shut them down and put them out of operation and go after the business end of their business. Because that's really how we're going to be able to stop this across the state of Florida.
On that point, knowing that the prescription drug database has been postponed and theoretically will kick into effect sometime in the next few months, early 2011, do you anticipate efforts like this growing once you have that additional capacity to go in there and look at files and build cases maybe a little bit easier?
Oh, absolutely. But because then you'll be able to target. We will know who the doctors are, who the pharmacists are, who are really just pumping out pills. And you know, Lord, I wish we had that system up and running now.
Can you tell us a little bit more about this database that's going into effect?
Actually, I'll let, you want to speak to it?
But it's
Since
still,
FDLE.
it's still, they're working through that as number one. There's been some issues, reference to the contract and database and some other things. So, we're kind of waiting to see, what the final product will be. Again, because we're still working with the prescribers and the doctors to try to come up with that system. So it's you know, I wish it was here, like the sheriff said, today, or I wish it was here in 30 days. It's still a little bit off from that, because one of the problems is there wasn't a strong funding piece for the database. And like creating any database, technology is not cheap. It's getting better all the time, but one of the problems was it was an unfunded type of thing. So we're working through all those, and again, we see it eventually as new technology, which will help law enforcement, you know, do its job every day.
But the real key to that system is going to be the fact that we're going to know who is dispensing particular drugs that may be abused out there.
I have a question for Mr. Williams. Looking at this board, seeing 2,300 roxycodones in district-wide operation, and it doesn't even crack the top 3 over here. Can you speak to some of the differences in usage? I'm guessing that roxycodone is coming more from more of the rural counties outside of this area.
Generally say it in rural counties. That's, you know, again, we're a transportation hub here, and so we're looking at drugs being transported into and out of here. It really depends on the community. It depends on the availability of sources of supply. We're seeing a lot of people now coming out of Tennessee and Kentucky. They're coming down to Florida to buy their drugs and carry them back. We've been working very closely with those 2 states and the HIDTA up there as well. So it really depends on the community. You know, if you have the larger the community, and generally speaking, the more of the pain clinics you see, and that's why you're seeing the large numbers here, as the sheriff mentioned earlier.
And also in reference to the successes that Duval County's had, one of the things that is happening is because the unit here is moving them. You know, it's like anything else, like even violent crime and stuff, you know, sometimes it's kind of like a balloon where law enforcement puts pressure, then they'll move to the least resistance. And that's why we brought the HIDTA program into those other counties, because what's happening now, traditionally, pain clinics are going to the urban areas because there's more possible patients. Now what they're seeing is if there's strong law enforcement, they're going to move to that next area. Because people will cover, like the director said, they're coming from other states to get prescriptions. To drive one county over, that's nothing. So now, that's why we went with the HIDTA program to now try to look at those counties too, so we try to surround this whole problem. And again, this is only phase 1. Phase 2 will come. We're not going to get into the details of what that may or may not be, but all these arrests will give us outstanding intelligence to go next. What's our next step? And again, the other piece is like the sheriff said, you know, one of the biggest problems with the prescription pills is we are the source country, okay? We don't have to look at this foreign source country in Mexico or Colombia and why it's so easy. They're here. They're in our community legally, and rightly so. There is people that need these drugs. But since we're a source country, we have to work together to stop this. And we can't just kind of necessarily say, well, that's that other country over there. If they stop their problem, we'd have no problem. Well, we're the source.
And if you look on the oxycodone, I know you can't see the numbers, but for the January through June of this year, oxycodone killed 167 people in our North Florida HIDTA. That is a large number. That's the brown number there under oxycodone, which is even higher than the benzodiazepine Xanax. But if you throw Valium and Xanax together, you know, then obviously that's more. And really that's what we're seeing more on the statewide level. But oxycodone is a killer in Northeast Florida.
I wondered if you could speak to, you were talking about law enforcement applying pressure here and moving pain clinics out. I wonder if you know from your partners in Georgia whether you've seen a significant movement toward that state.
As far as we can tell, not so much yet. Okay, but it's only a matter of time. What we're still seeing, though, is people from Georgia, Kentucky, Ohio are still coming to here because Director Ed Williams works with the other HIDTAs and recently went to a national HIDTA convention, and they're still saying everybody's coming to Florida to get their source of supply today. or Florida people are going, taking their pills up there. But again, 30 days, 90 days, 60 days on a problem like this, if Georgia tightens up their rules and regulations, then of course that could force them more down this way. And then the question what will be is what will Florida do next? And that's what we're saying that, like the sheriff said, it's not just a law enforcement issue. We have to get some legislation, we got to get some regulation to try to control and combat the problem.
In fact, if you look at the states where the people are traveling to Florida, you know, Kentucky, for example, they have a very good tracking system.
Right. Yes.
Can you talk at all specifically about this operation, how you were able to move in and get these drugs on the street and get these arrests?
Can you talk a little bit about the investigation?
Without going into too much detail, obviously there's an undercover aspect of it, intelligence gathering. It's a long process. Some of these pain clinics that we've looked into, we've worked since February. I can't go into the actual fine detail of the operation because that would let the next one that we're going to look at. So, very detailed with the cooperation of FBI, DEA, the health department. They all have a part in that. So, without giving you any more than that, I can't. But I will say that we find out when we get in that it's not just the users, it's the medical professionals, as you see over here, a medical doctor, a pharmacist, other medical staff. They all break the law, so to speak, and are held accountable.
Assistant Chief, of those 42 arrests, we see that 8 of them were in the medical field.
Yes.
Of the rest of them, could you sort of categorize how many of them were street-level dealers, mid-level distributors?
There's a system here. When I say VIP, you have individuals like in Kentucky. They'll have an individual that will front some money, maybe $15,000. That individual will front the money to an individual that will possibly rent a van, get 15 people together, travel down here overnight, show up at the pain clinic.